Hello everyone. Today we'll discuss about persistent diarrhea. So, starting off with the definitions. So, what is the meaning of diarrhea? So, diarrhea is nothing but the change in the frequency, consistency, and the weight of the stool is the meaning of diarrhea. So diarrhea is nothing but change in the frequency, that is there is an increase in the frequency. Consistency, the consistency will be a watery in consistency. Next, the weight of the stool. The normal weight in in the younger children, the normal weight of the stool will be 5 gram per kg per day. While in diarrhea, it will increase to more than 10 gram per kg per day. Okay. So this is the meaning of diarrhea. So it is change in frequency, consistency and weight of the stool. Next, what is persistent diarrhea? Going off with the definition of persistent diarrhea, actually the persistent diarrhea will start acutely. So this diarrhea will start as an acute episode. So onset will be an acute in onset which lasts for more than 14 days. Okay, and it is mainly related to infectious etiology. Okay, these 3 points you have to remember about persistent diarrhea. So it starts as an acute episode which lasts for more than 14 days and that has an infectious etiology. Why you have to remember these 3 points? Why? Because in chronic diarrhea, if you take for chronic diarrhea, it is also the same duration, but how will you differentiate between chronic and persistent? Chronic diarrhea, it is insidious in onset, first point. So this will be insidious in onset, which also lasts for more than 2 weeks, that is more than or equal to 14 days, and which is usually non-infectious in etiology. Okay, so this is how you differentiate between persistent and chronic diarrhea. Next, going off with the etiopathogenesis in persistent diarrhea. Etiopathogenesis. So, persistent mucosal injury is happening in this. In every diarrhea, there will be a mucosal injury. But in this persistent diarrhea, the mucosal injury is mainly due to infection. So, there will be a persistent mucosal injury. So, there is a persistent mucosal injury due to pathogens. So, what are the pathogens that cause these persistent mucosal injury? That are included as E. coli. Among E. coli, it is enteroaggregative E. coli or enteroaggressive E. coli. These both are being included. Next is Shigella, Salmonella and Campylobacter. Okay, these are the main infectious etiology that is causing a persistent mucosal injury. Not only the pathogens that causes only small intestine or intestinal injury, other associated infections can also lead to this persistent diarrhea. So other associated infections like urinary tract infections, UTI, can also cause this persistent diarrhea. Third, the host factor. The host factor is also important. Why? Because in host factor, if the child has a micronutrient deficiency, micro or macronutrient deficiency. Next, if the child has malnourished child, it is some child, or the child is an immunocompromised state. These children will have a persistent infection in them, plus the mucosal repair mechanism is impaired. This will cause a persistent diarrhea in these children. Next, fourth etiology, it is irrational use of antibiotics. It is irrational use of antibiotics. So when they use antibiotics of irrational choice, it will cause a suppression of normal gut flora. This will cause suppression of normal gut flora that will lead to bacterial overgrowth, that is pathogenic bacterial overgrowth. So normal gut flora will be suppressed, that pathogenic bacterial overgrowth will be present. That will once again lead on to the cycle of persistent diarrhea plus malnutrition. Fine. So these are the main etiopathogenesis. One is persistent mucosal injury due to pathogens like E. coli, Shigella, Salmonella and Campylobacter. Next, other infections with like urinary tract infection. Next, host factors with a child with micro or macronutrient deficiency or an immunocompromised state. Or next is use of irrational antibiotics. Next, risk factors. Next, we will talk about the risk factors. So risk factors that is can cause the persistent diarrhea or previous infection. They will have a previous infection. Second, when there is a recent introduction of animal milk. So recent introduction of animal milk which can injure the mucosa of the child. Next is lack of breastfeeding. Fourth, already we have found that there is a micronutrient deficiency, that is zinc and vitamin E deficiency in the child. Fifth, use of irrational antibiotics in the child. These are the risk factors for the child to have a persistent diarrhea. Next, the final common pathway of this persistent diarrhea will lead to, so the final pathway of this diarrhea will lead to prolonged small intestinal injury. Okay, it is prolonged small intestinal mucosal injury. Okay, this is the final common pathway that will result in persistent diarrhea. This mucosal injury is intensified. So this mucosal injury is intensified by protein energy malnutrition, ineffective villus repair, third, malabsorption of nutrients, fourth, when there is a deficient enteric hormones. Okay. Fine. So there will be a prolonged small intestine mucosal injury that is leading on to this persistent diarrhea. Fine. Next, what is the management? Next, we'll go in for the management. So the management principles are: first will be correction of dehydration according to our plan A, plan B and plan C. So correction of dehydration, electrolyte imbalance and hypoglycemia. Fine, this will be the first initial management. Second will be you have to evaluate for the infection. So you have to find the source of infection, evaluation of infection and giving an appropriate antibiotic for that. Third will be the nutrition. Nutrition is the key role in this persistent diarrhea. So nutrition, initially you should start with 6 to 7 feeds. So it is start with 6 to 7 feeds per day is being given. So total calorie intake you will start with 100 kilocalories. It is 100 kilocalories per kg per day, which will be increased to 150 kilocalories per kg per day. So the diets that has been planned in a child with persistent diarrhea. So diets that has been planned in child with persistent diarrhea is diet A, B and C. The diet A is a reduced lactose diet or low lactose diet, while in diet B is lactose free diet. Diet plan C, it is, or diet C, it is a complex carbohydrate diet or a monosaccharide. it is a monosaccharide diet. Okay. First, we'll talk about this reduced lactose. So reduced lactose diet, you will use milk, sugar and puffed rice. I am not writing in detail about the diet, how you are going to prepare. The main ingredients I am writing here, and what is their calorie for per 100 gram. Their calorie for 100 gram is 85 kilocalorie per 100 gram with a protein of about 2 gram per 100 gram. Okay. Next, this is reduced lactose diet. Next is lactose free. In lactose free diet, we use egg white with puffs and oil to increase the calorie. So calorie of this is 90 kilocalorie per 100 grams and protein will be 2.4 gram per 100 gram of this diet, lactose free. This is diet A, this is diet B, and diet C, that is monosaccharide. In monosaccharide diet, we use chicken puree in this diet form. Chicken puree, oil is being used as main ingredient. The total kilocalorie here will be 67 kilocalorie per 100 gram with a protein of 3 gram protein per 100 gram. This is the diet plan. You have to start the child. First, we have to start the child with reduced lactose diet. If the child is able to tolerate reduced lactose diet, then you can continue with that. If the child is not able to tolerate with the reduced lactose diet, that is, if the child is having increased frequency of stool, or if the child is not gaining weight, then you have to change to the next diet, that is lactose free diet. Okay, so before changing to next diet, or if there is no indications for changing the next diet, you have to continue the diet, the diet that you are giving the child for about 7 days. So duration of particular diet that you are starting should be given for 7 days. Okay, before changing to a next diet if there is no warning symptoms or signs. Okay. Next, along with this, you have to give a supplemental vitamins and minerals. So you have to supplement the child with vitamin and mineral. Okay, which everything is given as twice the RDA. So vitamin and minerals are given twice the RDA. First, iron is not started now. Iron is given only when the diarrhea is being reduced. So iron is started only when the diarrhea is reduced or the stopped. Okay. Next, third, vitamin A is given as single dose, while zinc is also given for about 14 days for the recovery. So both can enhance the recovery from the persistent diarrhea. Vitamin A and zinc, these are the two most important micronutrients that can enhance the recovery from the persistent diarrhea. Next, now the new diet that is being given for a child with persistent diarrhea, that is green banana. That is unripe banana. Why they are formulating unripe banana here? So this unripe banana is used for the treatment of this persistent diarrhea. Why? Because this contains amylase resistant starch. So this contains amylase resistant starch. This amylase resistant starch is not being digested in the small intestine. It is not digested in small intestine. It directly reaches the colon. In the colon, with the help of this colonic bacteria, this amylase resistant starch is being converted into or being fermented into short chain fatty acid. It is being converted to short chain fatty acid. This short chain fatty acid is absorbed along with along with the sodium. Okay, along with the sodium in the colon. So once the sodium is being absorbed in the colon, this will facilitate the water absorption also. So that by reducing the episodes of diarrhea. Okay. So this is the concept behind using the green banana or unripe banana for a child with what is this called, persistent diarrhea. Next, role of antibiotics. So in role of previously we have started, we have talked in etiopathogenesis, that is use of irrational antibiotics during the episode can also lead to persistent diarrhea. But antibiotics are indicated for certain situations, like indications for antibiotic, the child with the SAM, or where there is an evidence of systemic infection. So what is the empirical antibiotic you are going to use? So the empirical antibiotic of choice. So empirical antibiotic of choice will be combination of cephalosporin with aminoglycoside. Okay. So this is about the antibiotics. Next, successful treatment. When you call your treatment as a successful management or successful treatment is when there is an adequate food intake by the child. When there is an adequate food intake. Next, or when there is a reduced frequency of diarrheal stool. When there is a frequency of diarrhea, that is less than 2 stool per day, or when the child is having a weight gain, then you call them as a successful treatment. Okay. So this is about persistent diarrhea. In next topic we'll cover chronic diarrhea. So next will be chronic diarrhea. So in chronic diarrhea, this chronic diarrhea topic is also made simple. Okay, first mainly you have to differentiate between, in a stage 1 you have to differentiate whether it is a small bowel diarrhea or versus large bowel diarrhea first. Next you have to differentiate whether it is osmotic or secretory diarrhea. Next you have to look for any protein enteropathy, that is protein losing enteropathy. You have to look for protein losing enteropathy. Next you have to look for any fatty globules. This will be the first initial management. First you have to identify these things. After that you have to look for specific etiologies. Okay, so this will be the approach to a child with a chronic diarrhea. So as a definition we have learned earlier, chronic diarrhea means diarrhea for more than 14 days which is insidious in onset and it is of non-infectious etiology. Okay, we'll cover the chronic diarrhea in tomorrow's session. Thank you. Have a nice day. Let's all learn pediatric together.